Good evening. My name is Samuel Lively, and today we're going to be discussing mental health and mental disorders throughout this presentation. So, what is mental health? What are mental disorders? How do we diagnose mental disorders? What is the DSM 5? And how can we treat mental health disorders? So, as I stated before, we're going to be discussing mental health. We're going to be covering what mental health is, a few mental health disorders that I have chosen to talk about today. I want to focus on how these mental disorders are diagnosed using the DSM 5 and the different treatments for the different mental health disorders. So, what is mental health? What are mental disorders? And the DSM 5, what is that? So, according to the World Health Organization, mental health is basically a general state of well being, which allows individuals to cope, learn, and contribute to the community in which they live. And that was published in 2025. So, some different mental health disorders that we're going to be covering throughout this presentation include major depressive disorder, generalized anxiety, post-traumatic stress disorder. I want it to be noted that mental health disorders are not limited to these alone, but due to the vast amount of disorders out there, these are the ones that we're going to be focusing on today. When it comes to the DSM 5 and how does it really relate to mental health, like what is it? The DSM 5 is the Diagnostic and Statistical Manual of Mental Disorders. It was published by the American Psychiatric Association, and this book allows us to utilize it to diagnose mental disorders based on a set criteria that they've established, based on behavioral or emotional patterns that are seen within patients. So the first mental disorder that we are going to be discussing today is major depressive disorder. So what is it? How can we diagnose it? And what are some treatments for major depressive disorder? So major depressive disorder is the third ranked disease that burdens Americans. I want it to be known that it, first off, we're diagnosing it using the DSM 5. And you have to have at least 5 symptoms in order to diagnose this. And some of these symptoms could include, but they're not limited to, lack of energy, poor concentration. Sometimes patients will have suicidal ideations, sleeping troubles, or just overall decreased interest in activities that they enjoy, or even appetite changes. You may eat too much. You may not want to eat anything at all. So a patient has to have at least 5 of those based on the DSM 5 and the criteria that's enclosed within major depressive disorder in order to be diagnosed with this. Once diagnosed, treatments for major depressive disorder include both pharmacological and non-pharmacological methods. Some non-pharmacological methods that I want to touch on today can include lifestyle alterations, therapy. A popular therapy that's used with patients with major depressive disorder include cognitive behavioral therapy, and even electroconvulsive therapy has been used in treatment with these patients. When we're talking about the pharmacological therapies, I want to just touch on that these are going to be the medications that we use to manage this disease. And these can include antidepressants as well as SSRIs. And these are just 2 forms of the many options that we can give to these patients when dealing with major depressive disorder. Generalized anxiety disorder. So what is it? How do we diagnose it? And what are the treatments for it? So generalized anxiety disorder has been classified as a mental health disorder in which individuals experience a state of fear, worry, or just generally feeling very overwhelmed. It can be noted that some individuals who experience these feelings may also have unrealistic worries about everyday items, such as is my car going to work today? I set 3 alarms. I feel like I'm still going to be late for work. These are just some examples that we can give when talking about generalized anxiety. The exact reasoning behind this disorder this disorder is not fully known, but according to the DSM-5, you still have to meet a certain criteria in order to meet generalized anxiety disorder. And this includes having excessive worrying or anxiety for at least 6 months, and a difficulty in controlling these feelings of worry or anxiety. Not being able to control them is a big factor in that. Other symptoms that patients or individuals may experience when being diagnosed with generalized anxiety disorder include fatigue, sleeping complaints, either they're sleeping too much or too little. Even though they're sleeping, they still may feel fatigued. I just want to make that known. These patients also may have an unstable mood. They can be very, very happy one minute and crying the next. And they can even have a difficulty in concentrating. Some notable factors that can contribute to this disorder can include like poor health, lower levels of education, just the presence of stressors in one's life, and even the female gender has been known to have a higher level of generalized anxiety. So when we're talking about treatments for generalized anxiety disorder, we're going to include two main treatments. One is the cognitive behavioral therapy, which we just touched on with depressive disorder, and it's used to help adjust the patterns that one individual may be experiencing, trying to guide them into a more positive direction. And then we can also slowly introduce them into a more stressful situation. So if they have a fear of water, I had a college roommate at one point who had a fear of water. So she would wear a bathing suit into the shower. She would slowly turn on the water. And it was a process over time to help her overcome that fear. And that's just an example that I can use to help that. A second treatment that's going to be used with generalized anxiety disorder is going to be pharmacological treatments. And this includes antidepressants, your benzodiazepines, and sometimes even antipsychotics can be used with these patients. The next one that I want to touch on is post-traumatic stress disorder. This one is very near and dear to my heart. I know many people who have this and go untreated or fly under the radar simply because they don't want to be diagnosed with this disorder. So post-traumatic stress disorder, otherwise known as PTSD, it's a very complex psychiatric condition, and it arises after exposure to a traumatic event or situation, and it really impacts the individual's mental status and just overall well-being over a period of time. Post-traumatic stress disorder, it can affect individuals' overall mood, their cognitive behavior, and this can actually lead to a higher likelihood of suicide in these patients. The DSM-5 criteria for these patients being diagnosed, it's going to include experiencing a traumatic event, whether that's a traumatic death, a serious injury, and even sexual violence can be included in this. In addition to experiencing symptoms such as nightmares, avoiding certain behaviors, they could have negative changes in their mood and increased awareness of situations. They may be hyper aware of their surroundings, or if they're put in a dark room, if it relates to their trauma, those patients are going to be extremely hyper aware of what's going on. PTSD pathophys, so it is actually caused by a surge of adrenaline from the sympathetic nervous system, and that can lead to tachycardia. You can have increased blood pressure, and it releases cortisol into the system. And if it's lasting for long term, this is what causes your post-traumatic stress disorder. So when talking about post-traumatic stress disorder or PTSD, the treatments for this disorder can be like a psychotherapeutic approach. So this includes your cognitive behavioral therapy. This can be exposure therapy, so exposure to maybe that said event, or even EMDR, which is eye movement desensitization and reprocessing therapy. Medications are also used It's also an option for patients with PTSD in the treatment of, and the most common one that's used are going to be your SSRIs. So, question number one. According to the DSM 5, a patient has to have which of the following when diagnosing major depressive disorder? Lack of energy, depressed mood, suicidal thoughts, sleep disturbances, feelings of guilt or worthlessness, or all of the above. So the answer to this is going to be all of the above. So again, according to the DSM-5, a patient being diagnosed with major depressive disorder has to have at least 5 symptoms of those listed in question, but one of them must be a depressed mood. So question number 2, what is the most beneficial therapy for a patient with generalized anxiety disorder? As we talked about in the previous slide, that is going to be your cognitive behavioral therapy. And finally, question number 3, prolonged exposure to a traumatic event or situation can lead to post-traumatic stress disorder, which is a symptom seen with prolonged exposure. And our answer for that is going to be tachycardia. These patients are going to be almost in a fight or flight mode, which is going to cause tachycardia. It's going to elevate their blood pressure. It may cause them to start to sweat, be very, very overwhelmed. These are just some things that you can see with your patients who are experiencing PTSD. So finally, here are my references. I just want to thank you for taking the time to watch this presentation. I hope that you were able to take something away from it. Just let it be known, mental health disorders are not biased. They can affect anyone. And it's very important to seek out help and treatment. And again, thank you so much for watching this presentation.